I worked with someone a few years ago who'd been trying to get pregnant for quite a while by the time she came to see me. When we sat down and chatted for the first time, she told me about how painful and heavy her periods were. And she'd seen quite a few doctors, her OBGYNs, her primary care doctor, and they had pretty much told her that it was completely normal to have these painful periods. They told her to take pain medications, use heating pads, just regular things to deal with the pain. And as she was telling me this, I sort of thought to myself, it sounds like she has endometriosis. We went on to do her ultrasound, and there were clear signs of endometriosis on her ultrasound. Endometriosis is where the inside lining of the uterus grows on the outside of inside the pelvis. And every time you bleed and have a period, you're actually bleeding internally wherever that endometriosis is situated, whether it's inside the muscle of the uterus, inside the ovaries, or inside the wall of the pelvis. When I explained this to her, she was shocked. She said that she'd been seeing doctors for years and years and years, and nobody had ever told her that. I told her that, unfortunately, particularly for Black and brown women, the diagnosis can take up to 10 to 15 years to be made. Endometriosis affects at least 1 in 10 women, probably more, but the signs and symptoms are often dismissed. It was a relief to her to actually have her signs and symptoms explained to her. She felt heard, she felt validated, and we were then able to move forward with helping her with her goals of fertility and building her family. And she now has a lovely baby.